Hi everyone, back with another quick short video just about someone who I saw. It's someone that I know and their child, their daughter, and she was probably 12 or 13 at the time. And at the time, she was having issues with her braces, right? The braces on your teeth. Yeah, that. She had double braces, top and bottom. So, they would be too tight for her or something, because normally, everyone, those are terrible to be in, so everyone can complain. But she would have pain, or one time, I think some of the wires would bother her. But yeah, normally the kids have problems with braces anyway. They're bothersome to have. So because of that, she would have some pain, like mouth pain. And, typically for kids, you can't really give them too strong of a painkiller. So you can give them, just a normal Tylenol, Advil. Though they say Tylenol is better. And Advils can work too, but just not, in limited quantities for the swelling, that can happen with that. And so at one point, they recorrected the braces in her mouth because she was having an issue with them. So she went in and get them recorrected. And they mentioned, she was having a lot of pain because of that. So they did end up prescribing her something. All right? This is a child. And it's the least of what you expect. All right? So, what did these people end up prescribing her? They end up prescribing her one of those easily addicted medicine. You know how they're mentioning now that doctors are over-prescribing those opioid, opioid, I believe. But yes, it was one of those. Those painkillers, the strong ones you can get easily, like Oxycontin, Vicodin, all of that. So they prescribed her one of those medicines. See if I can look up the name. It's funny if you think about it, right? So one of the greater producers of opioids at this time that distributes them around. It's funny because at one point actually banned opioid use. Many hundreds of years ago, they saw it as an issue, as a problem. So they saw the effect it caused on society. So they banned it, right? But there was still a legal trade and it became such a big problem. So they passed laws banning the trade of opioids, right? So at one point, then there was Britain that needed those said opioid. So they didn't get enough of a supply, so they started to grow their own. And with that, they sold it back into that country. So at that point, their numbers of addicts influx. So then they had a real problem. Many addicted people in their country. So, the roles kind of reversed over hundreds of years. So at one point, if that Europe was creating these drugs that were banned, these opioids, and there was a war about it, and they were distributing it to the said other countries that in which they were banned, and so creating now a big problem of addicted people. And it's funny that the rules are reversing, and so now that country is now creating the opioids in return and distributing them into the United States. So it kind of is like the rules have reversed over like hundreds of years of history, but yet still nobody can learn from the history and understand why these opioids were banned and why they were dangerous and why they were limited use. And so now with doctors prescribing a high rate of opioids, and so this problem is increasing and increasing. So as you can see in the news, recently they had a doctor in the court in which he was just prescribing opioids to people like illegally. So high rates, and they do it legally also, because I can tell you another story. So there was this one doctor, because obviously I saw it with my eyes. This one doctor, there are many doctors around her, right, that had the same specialty. Like they treated the same exact problems as her. But for some reason, because when the patients leave, you see, like, you know what they, I mean, even when they go in, but especially when they leave, like, you know what they were treated for, you know their medical, situation, and you know what medicines are being given to them. So when these patients are leaving, right, so you see all of this information, right? So there's one doctor, and even if there's a whole bunch of other doctors in the same specialty, for some reason this one doctor was the only one over-prescribing opioids. Like, she would give it to everybody, even if they didn't need it. Like, every single patient, like, she would give opioids over. Like, every person left out of that place with an opioid prescription. So I was thinking to myself, why is she even prescribing this? Because some people may not even need that, and they're highly addictive. And some of the patients actually mentioned to me, I don't really need this medicine. I don't really have like pain or anything like that, so I'm not sure why she's prescribing it to me. And because I'm not really having pain like that. Like more than one person told me this. So, but she told me she just prescribed it just in case, and for me to just take it. But I really don't need this. So I was thinking to myself, like, why is the doctor prescribing every single patient opioids? Like, everyone, especially the ones that mentioned they don't need it, and especially to her. So, and as you can see on the news, they have an incentive to prescribe these opioids. There's like monetary incentive. So there's like this program, as I didn't know about it at the time, but I kind of guessed it would be something like that, a money grab. So as the news recently uncovered, then that is the problem. So that's why these doctors are overprescribing these opioids and creating a problem in the society where there's a high addiction rate. So I saw it from my very eyes. You have this whole slew of doctors, and like many of them specialize in the same exact thing as this one doctor. Like, they basically the patient can say, hey, I don't like this woman, I'm going to go to the doctor right next to her. And yes, they treat the same exact problem. So why does this one doctor, out of all the doctors there, the one to overprescribed opioid. Like every single patient, I'm telling you, every single patient. So every single patient got opioid prescription, and that is a problem now. So that is basically what I'm telling you, that from what I saw from my eyes, and as like first-rate experience. But these people are protected, by those higher institutions. So it's not like the medical companies are going to do anything to them. And that's the problem now, because they are really protected. And so they can get away with many crimes inside of medical institution. And they are definitely protected. So just keep an eye on those things. Don't trust everything you're seeing. Question everything about a doctor. Question why are they giving you a certain medicine. Do your research. Question their behavior, because not everything is what you think. They don't really have sometimes the best interest of you. They have the best interest of their pocket. So check that out and just keep an eye.